guys, welcome back to Quick Nursing Shorts with Smita, and today we'll talk about constipation, which is a condition under GI disorder. So we'll see how to write constipation for 5 marks as short essay type of questions. Starting with the definition, definition says constipation is a term used to describe an abnormal infrequency or irregularity of defecation or retention of stool in the rectum for prolonged period. So if there is a problem with defecation and the hardening of stool is happening and defecation is not happening on regular basis, that is called constipation. So the reasons, etiology, it says medications, taking medications like tranquilizers, anticholinergics, antidepressants, hypertensive, and opioids like opioids or other painkillers for prolonged period of time, or having misuse of these medicines can cause constipation. Patient who has already a rectal or anal disorder like hemorrhoid and fissure, they will be having difficulty in having defecation process leading to constipation. Then obstruction due to cancer of the bowel or appendicitis, it will become an obstruction in the feces to pass or defecate, leading to constipation. Then metabolic condition like diabetes mellitus, neurologic and neuromuscular conditions, endocrine disorders, hypothyroidism, and in also case of lead poisoning, it will also lead to constipation. On people having dietary habits like not taking much fibers in their diet or avoiding green vegetables completely, and also not taking much of fluid, intake of less amount of fluid will also cause constipation. Those who doesn't do regular exercises or those who are bedridden patient, they will have this problem of constipation. Stress filled life, when the person is completely stressful, they will have this difficulty in passing stool. Then irritable bowel syndrome is another condition which will cause constipation. Having connective tissue disorders, or it says that constipation is the major problem for patient taking opioids or for chronic pain or other painkillers. If we see any cancer patient, you can see a cancer patient usually faces this problem of constipation and they will be on laxatives. So next thing is pathophysiology. Now we'll see what is the mechanism behind constipation. So it says that pathophysiology of constipation is poorly understood. So due to the reasons which we have discussed, due to the reason and risk factors, there will be interference in one, two, or all the major functions of the colon. So majorly the colon has these three functions in regularance of bowel function. So the first is mucosal transport. In mucosal transport, there will be a mucosal secretion which helps in the movement of colon content, that is the feces, and myoelectrical activities, mixing of rectal masses and propulsive actions. Then third is the process of defecation. So if there is any problem with these three things or any of these three things, there will be a constipation problem. So in the first and second thing, it's very clear. The third thing is the process of defecation. So in the process of defecation, what all the things can be interfering? Obviously, having cancer or any obstruction like fissures and fistulas, hemorrhoids. So these are the things which will directly interfere with the process of defecation, and then the person will lose that sensation or urge to defecate, leading to constipation. So this is the pathophysiology which is not clear, but still in a vague explanation we can say that this is how constipation occurs. Then moving on to the manifestation or signs and symptoms. So always try to relate manifestation to you and with you. If you ever had any of these problems, then you can just relate to that situation, what all the things you were facing and what all the symptoms you were having that day. So, the first and foremost, there will be abdominal distension, a feeling of bloating inside the stomach, and borborygmi. Borborygmi is a bowel sound, that is that gurgling and rumbling sound inside your stomach, which happens when there is a gas movement through the intestine or when there is the food movement in the intestine. Then pain and pressure. So due to this hard stools, the person will experience pain and they will try to put a pressure also, and they will always feel that there is a pressure in their anal region, but they are also unable to defecate that. Then decrease appetite. So due to stagnance of bowel mm, bowel content, the person will lose their appetite, and then there will be a headache problem. Headache and fatigue is being seen in these patients. These are the common symptoms, and it happens because of fluid volume deficit. In this case, the fluid volume, there will be imbalances in electrolytes, and also the fluid volume will be disturbed badly. That will lead to headache and fatigue. Then person will experience indigestion. The food will not be digested because there is no space for the food to move after the stomach. Then sensation of incomplete emptying. Even after emptying the bowel, the person will feel that they have not completely emptied their bowel. That is the sensation of incomplete emptying. Then straining at stool. When a person with constipation, they give a lot of pressure, and they strain at the stool while throwing out or while expelling the fecal matter. So that strain or pain. Then the elimination of small volume hard dry stool. So constipation is that condition where we experience that hard and dry stools, and then there will be a lot of pain even in expelling the small volume of fecal matter. So this happens. Then assessment and diagnostic. In here we need to as a nurse, you need to take a detailed history of the patient, their medical condition, their medication, what all the medication they are on or past taken medication, and also if they had any past surgery or past GI surgery. Then physical examination. In physical examination, check their abdominal girth and abdominal distension. Uh, do all the inspection, percussion, palpation, and auscultation. Try hearing Borbogami sounds. Then barium enema. Barium enema is the investigation process which is done to find out what is the patency of the intestine, or if there is any obstruction or the reason behind constipation. Then sigmoidoscopy. Here we try visualizing the sigmoid and colon area through this sigmoidoscopy procedure. Then stool testing for occult blood. In case the patient is having uh, any bacterial infection or something, due to that, if the constipation has occurred to the patient, then we'll send the stool sample to the laboratory. Then having anorectal manometry. So anorectal manometry, here we will try to determine the pressure in the anal region, and also we'll try to find out if there is a problem with the muscles, or if there is a problem with the anal sphincter. Then there are chances of having complication with constipation. If the person is having constipation for a long period of time and they are frequently facing constipation problem, then there is a chance then they will be having hypertension later on. And the fecal impaction. Fecal impaction, what happens, the fecal matter gets stagnant in one place, and then it start getting hardened in that area. That will become an obstruction later on. Then having hemorrhoids. So hemorrhoids, in local word we call it as piles. So the person, when during straining while defecating, there will be a they will be rupturing the vessels because of that pressure, because of that strain which happens unwantedly, and that is called hemorrhoids. Then having anal fissures, same reason, due to straining and due to giving that pressure on the anal region, it will cause tearing the lining of anal canal. Then there will be mild bleeding and also chances of infection to happen. Then megacolon, due to stagnant and stagnant of that due to stagnancy of the bowel matter or fecal matter in the colon area. The colon becomes larger and larger day by day. That is the megacolon. When colon turns into a megacolon due to fecal matter retaining at the same place, that is a megacolon. Then valsar manure, it happens when you try putting pressure while defecating, while trying to throw out the fecal matter, and the same time we try to forcibly exhale out with the glottis closed, and it always result in increased arterial pressure. We also feel when we are trying to strain and put pressure on anal region during constipation, we feel that there is pressure in our veins also and arteries also. So this is what happen when you abnormally try to breathe and exhale like that. Then medical management, first of all, it says that having a bowel habit training, it is recommended that any person should have a bowel habit training from their childhood onwards. So there will be a pattern throughout their life cycle. Then increase fiber and fluid intake. Try involving more of green vegetables, green leafy vegetables, and try taking much of more waters. And at least 4 liter of water a day should be consumed by every person. Then judicious use of laxatives whenever it is necessary. Then appropriate time the laxatives should be given to the patient. Discontinuing of laxative abuse, it means that person who is having constipation and they keep on taking laxatives every day to defecate, that is a misuse or abuse. When the person does not even attempt to have a normal bowel habit, that is the abuse of laxative. So we need to discontinue that laxative abuse then and there. Then having a routine exercise to strengthen your abdominal muscles, that is good for having a good bowel habit. Then biofeedback is a technique like Kegel exercise which we do in urinary system. With urinary system, the same thing is biofeedback. This is the technique we can help the person to learn how to relax and hold their sphincter mechanism when the time to expel stool. Then enemas and rectal suppositories. Rectal suppositories are the tablet which is in cone shape. So we need to put those suppository in the anal canal. Through the same route we need to put it on the person, and after a few minutes the person will feel like to defecate. Same way enema, which is a liquid and it is given through anal route, it will be pushed inside for, and the patient is asked to hold for a while, and after 15-30 minutes the patient will have the urgency to defecate. Enema and rectal suppositories are the two things which we do at last, and before that we try preventing having constipation and we try doing the other things. Then nursing management, here our main aim is to give health education on how the person can prevent having constipation. And so we need to teach the patient that they should have a regular pattern of elimination. They should make a bowel habit training uh, to pass stool in the morning and to have this bowel training. So whenever they get up in the morning, first thing they need to do is to defecate. So that training will be lifelong, it will be utilized. Then ensuring adequate intake, so teach the person or the patient to have more of fluids and more of high fibers like green vegetables or kales in their diet. Then learning about methods to avoid constipation, what all the medical management we have seen. So those management we need to apply here, teach the patient how they can avoid having constipation. Then relieving anxiety, if your patient is anxious always, first of all give them psychological support and teach them what is happening to them and why it is happening and how it can be avoided in future period. And try avoiding complication. The complication which we have seen is actually worst when it happens, so it's better to treat constipation and avoid having complication. Then nursing diagnosis, we have acute pain related to inflammation and infection, constipation related to the reason why the person is having constipation, then deficient knowledge related to disease condition, anxiety related to constipation. And if there is any other diagnosis you feel like writing, you can add it on, because I have written only 4 diagnoses which is actually related to the disease condition. Now, so we have finished our 5 marks question in detail. So this is the end of the topic. I hope you guys have gained the knowledge and I hope you guys are studying well. So have a good day. Thanks for watching my video. Do like, share and subscribe. Bye bye.